Hello everyone, how are you? Welcome to another question and answer session for MRCS exam. Here, this is the question. A male infant is born by emergency cesarean section at 39 weeks gestation for fetal distress. Soon after the birth of the baby becomes progressively hypoxic and examination is found to have a scaphoid abdomen. What is the most likely underlying diagnosis? So it is one of the important question that in this question they want to know about the underlying diagnosis in a case where emergency cesarean section was done at the 39 weeks of gestation, and after the delivery patient progressively hypoxic, that means there is deficiency of the oxygen in the body and found scaphoid abdomen. So we have to find out the cause. Here two important clue: one is the scaphoid abdomen, another one is patient is hypoxic. So here the options are intestinal malrotation, hiatus hernia, foramen of Bogdalic hernia, foramen of Morgagni hernia, and tracheoesophageal fistula. So first of all, here we can see this is the baby born after uh, born. We can see here it is the abdomen, and abdomen is situated more below, and it is the scaphoid shaped abdomen, and we can see this is the chest, and chest is larger and widened, so something present in the chest, but in the abdomen something absent. So let's see some of the clinical feature here. So here we can see this is the diaphragm, and we can see there is two important hernia may occurs to the diaphragm. One is the Bogdalic hernia, which lies in the posterolateral part of the diaphragm. On the other hand, we can see the Morgagni hernia, which lies anterior to the diaphragm. So here in this picture, we can see in the first and second picture, we can see that the content which lies in the chest wall. Here we can see this is the bowel gas shadow. These bowel gas shadow are present within the chest wall. In the first and second picture also, here this picture also, here we can see the bowel gas. So here the clinical feature we can see in this first and second picture. In the first picture we can see the part of the small intestine. Here this is the small intestine. They are herniated into the chest wall, and here the lung field is occupied by the intestine. So this part of the lungs are hypoplastic, and in the second picture also, here we can see almost all of the gut are present within the chest. So they usually present in the abdomen, but in this case this content through a foramen enters into the chest, and this side of the lungs is hypoplastic. So by one lungs there is very difficult to continue breathe. And here the two types of hernia, one is Bogdalic and another is Morgagni. Bogdalic hernia is most commonly occurs, it is 90%, and Morgagni it is 2%. Bogdalic hernia it lies posterolateral, and clinical feature develops very early, and more often it is left sided. But Morgagni hernia it is anteriorly location, it usually occurs late after birth and more often in the right side. So this difference is very important, that Bogdalic hernia it is most common, about 90%. It lies posterolateral, occurs very soon after the delivery, and it is often left sided. On the other hand, Morgagni hernia less common, anteriorly located, it occurs later after the birth, and it often right sided. So our answer is now ready, because the baby become hypoxic just after cesarean section, so there is foramen Bogdalic hernia. And scaphoid abdomen, that means the abdominal content it is not present in the abdomen, it reaches in the chest through a foramen, which is the Bogdalic foramen. So the hernia through the Bogdalic foramen it occurs in this child, and it occurs soon after the birth, that means very early, so it is Bogdalic hernia. Thank you all.